welcome to Day Home Divas. I'm Joanne,
I'm Cash.
And I'm Sophia.
and this episode we are going to discuss kids and biting. Biting is probably the one behavior that early childhood educators fear the most. It's frustrating, not just because of the action itself, but the snowball effect it causes. One child bites another, now that child is upset, which rightly so. But then you have to help the injured child, talk to the biter, and then you have two sets of parents to discuss the incident with, all while hoping none of the other kids witness the situation and are plotting their copycat actions. So biting is very common in early childhood for infants and toddlers up to age 3. Babies and toddlers bite for a variety of reasons: teething, exploring a new toy or object with their mouth, frustration, lack of communication skills, anger, and so on. As they begin to understand cause and effect, they also might bite a person to see if they can get a reaction, and boy, do they ever. Biting also can be a way for toddlers to get attention or express how they feel. So, like their frustration, anger, and fear are strong emotions, and toddlers lack the language skills to communicate how they are feeling. Instead, they may bite as a way of saying, "Pay attention to me," or "I don't like that." Toddlers may also learn that biting can be used as a tool for accessing a desired item. They want something another kid has, they give that kid a bite, and suddenly they let it go. So they figure out pretty quickly that that works.
It's also part of the communication. They want that toy, but they don't want to communicate to them that they want that toy, so they just bite them.
Yeah. Or they have said, "Can I have that?" And the other kid says no, and they're like, "Well, you're going to give it to me now."
And I think some people forget too that when they bite for attention, it's not necessarily a negative attention. It's just more they're learning their surroundings. So what are they going to do to get that attention?
Especially if, the first time they do it to mom or whatever, and mom's like, "Don't bite." It's like, oh no.
Well, and my favorite is if you bite me, you go down. You don't stay with me. You get down.
Yeah.
Go.
Yeah.
Biting is slightly more common in boys and tends to happen most often between the first and second birthday. As language improves, biting tends to lessen. After age 3, children usually bite when they feel powerless or scared, such as when they are losing a fight or think they are going to be hurt by another person. Children older than 3 who often bite other people need to be seen by a doctor. Biting that happens past age 3 or occurs frequently at any age may need treatment. Parents should have a zero tolerance rule for biting at home, daycare, and elsewhere. Everyone needs to be on the same page. If a parent laughs when they bite at home, the child will think that it's funny, and they won't understand when they get into trouble at daycare for hurting another child. Like most things, consistency is key. If it does happen, be sure to deal with it right away. There are many different ways to handle a situation, and not all kids will respond the same way.
So the next time your child bites, try these steps. Step 1, be calm and firm. Address your child with a firm no biting or biting hurts. Keep it simple and easy for a toddler to understand. Make it clear that biting is wrong, but avoid lengthy explanations until your child is old enough to understand. Remaining as calm as possible will help resolve the situation more quickly. Step 2, comfort the victim. Direct your attention to the person who has been bitten, especially if it's another child. If there is an injury, clean the area with soap and water. Get medical care if the bite is deep or bleeding. Step 3, comfort the biter if need be. Often toddlers don't realize that biting hurts. It's okay to comfort a child who feels upset about hurting someone. An older toddler might learn from being allowed to comfort or apologize to a friend after a bite. But if the biter is using the behavior to get attention, you don't want to reinforce this behavior by giving comfort and attention. Step 4, offer alternatives. When things have calmed down, suggest alternatives to biting, like using the words no, stop, and that's mine when wanting to communicate with others. For example, show your child how to approach a peer, put out their hand, and then say, please, to ask for an item. Step 5, redirect. Distraction works wonders with kids this age. If emotions and energy levels are running high, or if boredom has set in, help redirect a little one's attention to a more positive activity like dancing to music, coloring, or playing a game.
The whole idea of comforting the biter can be a tough one, right? When they've just bitten somebody and you're comforting that person and then they start to cry, in that moment can be super frustrating and annoying. No, you just bit them. Why are you crying?
Yeah.
Right? So it's definitely, that is a challenge to remember to stay calm and to not, just want to shun them because it is such a, like, thankfully it doesn't happen so often, but when it does, when you get a biter, it's like, no, it's just so much work. It's so much work.
I don't know. I don't think I've never had a biter, but I only have older kids and they don't bite.
I have one right now. I have two.
You have two biters right now?
Yep.
Oh no.
And they bite each other.
Well, I mean, tit for tat then.
I think too, for offering alternatives, especially depending on age, you can give them toys to chew
Yeah.
instead of biting people. So I have like a little bin of special toys, and it's like, no, here, bite this instead. Chew it.
Mhm.
Tear it
Yeah.
apart like a dog if you really want to, but that's what you do.
Yeah. Yeah, it's a tough one, man. Thankfully, I think I've only had a couple. So funny story. I had this one mom and she was like, my son's getting bit. He's got bite marks on him. And I'm like, okay, but there was never, like, during the day, there was never a situation when he was like, they bit me or anything like that. So I'm like trying to explain to this mom, I'm like, I'm really sorry. I am gonna keep extra attention on them to figure out who's doing this biting, because I'm like, your child's not reacting. So like I didn't know. So then I feel awful. Like, how do you have someone biting someone else and you don't know, right? So I'm like watching this kid like a hawk and nothing. No one's biting. Nobody else has been bit. There's nothing going on. I'm like, I honestly I don't know what's going on. And he was an only child, so it wasn't a sibling or anything. So I'm like, mom's angry, and I'm like, I don't know what to tell you. So I'm like, for a whole week, this kid, I'm like, no, you stay with me because I need to know who is biting you. Nothing. The following week, the mom comes back and she's like, oh yeah, so don't worry, he's not getting bit. I'm like, what? I'm like, I've seen the circular marks. What do you mean he's not getting bit? He has ringworm.
Oh,
It looks like bite marks. I'm like, oh my God. Like,
I don't know what's worse.
right?
I think I might take the biting over ringworm.
I was just like, oh, thank God, which made me sound awful, but I'm like, my week had been hell watching it, like, and I'm trying to keep all the kids separated. And so they're like, what is going on? Why can't we play? I'm like, too close, separate, not so close. They're like, what is up? And I'm just, yeah. And I was like, oh my
That's
God.
funny.
Yeah.
Have you had anyone bite themselves just for fun?
That's what I thought with this story was going. I thought it was
Oh.
going to, oh, guess what? He's biting himself.
I have two.
I questioned mom about that at first until he had one on his back, and I was like, oh yeah, that one. He definitely, unless
Yeah.
he's like some contortionist or whatever. I'm like, yeah, that he probably didn't do himself. But
So I've had a couple that bite themselves. Like my daughter, even just a couple weeks ago, gave herself a hickey. Like, why? What's the purpose of it?
apparently, I used to chew on my big toe when I was little.
Oh my God. Oh, you are weird.
Right? Me? Weird? No. Yeah, my sister would suck her thumb and I would chew my big toe.
Oh man.
I can't even reach my toes. I don't even think I ever have.
I used to before I started running. I don't know if I can now. I have no flexibility anymore, but for a long time I could. So if the chomper bites before you can stop them, they need a consequence. With a young toddler, start with a mild consequence. Remove them from the play. If the bite happened over a toy, take said toy away, things like that. Sometimes simply saying, mommy doesn't like biting, fails to work because it's way too sweet. And remember, in emotional situations, what you say is much less important than the way you say it. So be firm and wear a serious expression to match no biting or we don't bite is more direct and a much more clear message. It reminds me of when this one biter I did have, and I said, I don't like it when you bite. The kid, 2 years old, goes, that's okay, I do. Damn it. Fair enough. So yeah, so saying mommy doesn't like biting doesn't mean as much as they might like it, so it doesn't matter. So if you happen to see your tot open his mouth right as he's about to nip, give some fast, hard claps, make a deep, menacing growl. Can it stay?
Can you, Joe, can you give us an example of what you would do? I need to hear this.
Okay, here we go.
Okay. What's that? It sounded like a fart.
This is from an expert. Not me. This was an expert with these explanations. Because there we go. How was that? Was that better?
That'll work. Absolutely.
Okay.
Definitely that'll
Okay.
work.
Could you imagine though, like if your kid opens his mouth to bite and you just go, "Grr!"
I do it. I can't. I don't think I could ever do that. I don't know about these experts.
I would laugh hysterically. I mean, not only is it for one, probably gonna terrify the poor kid. You're growling at them.
Right?
But now they're biting and you're growling. So that makes sense. Okay, we're gonna leave this bit in for people, but please don't growl at your kids.
Yeah, please don't growl at them.
Yeah, I mean, sharp claps, absolutely, because you're trying to like distract them quickly, right? So I get that. Or to be like, hey, don't bite. Like you're gonna make them jump, but you're totally distracting them.
Yeah. But don't growl.
But a quick like,
They might be stunned.
don't think
Go
it's
home and be like, she was growling at me.
right.
Parents are like, what in the world is going on over there?
And then can you imagine trying to explain that? Well, he was about to bite someone, so I growled at him.
Oh gosh. Oh gosh.
All right. So yeah, so don't growl. Do a double take with a warning finger held up. Hey, no bites. No bites. Don't stare at your child after the warning. Staring may make a defiant kid or something.
Okay, so you clap really hard, you growl, but you don't stare at the child, and you say no bite, while looking somewhere else.
But have you seen some of those kids? If you stare at them, they're just going to look at you and do it anyways.
Just I try to imagine this poor kid is just, I mean, not poor kid because they were going to bite somebody, but this poor kid is all open mouth, ready to bite. Turn away. You don't look at them and you go, hey, no bite, grr. And I'm like, what the fuck is going on?
Dying.
Oh my goodness. Oh,
I can't even breathe.
this made so much more sense.
Oh my
When I was reading their thing as a whole, like these experts, I'm like, yeah, this makes sense. The hey, no bite. I don't know how I skipped over the growling part.
Oh
Yeah. But I do agree with the hey, no bite. Like you want like that quick, like sharp response to kind of make them jump, but like not terrifying them, but just make them like jump a little to like stop what they're doing. And then you can say, we don't bite our friends.
Yeah.
Right? Like you're just trying to distract them. That's what I'm trying to get at, I think, here. You're trying to distract them like it is a preventative thing. So stick with the hey, no bite, the clap. Oh my God.
We have to keep this in. We can't.
Oh, it's staying in because parents need to see and like other educators need to see that like not every expert
Is
is
correct.
maybe Yeah, exactly. Over time, there's been ways that we've stopped, right? Like I'm a Gen X. When my kids were little, almost 30 years ago, if they bit me, my own children, not other kids in my care, let me make this very clear. The children that I grew in my womb, if they bit me, I bit them back. And they stopped. Like, that's why I'm making this very clear. I have never bitten and would never bite somebody else's child. My own kids. You bite mom, mom bites you back. 30 years ago, to be clear. I mean, there's methods that worked. And I mean, my kids, they only bit once or twice. That was it.
Mhm.
Is it the ideal discipline? Probably not, but it works. Just saying.
Yep.
Not advocating for people to bite children. Just want to make this clear before we get all these messages. Why are you telling everyone to bite? I am not. Story from a long, long time ago.
Immediately remove your little biter from the situation. Give him a cold shoulder for 20 to 30 seconds while you lavish some sympathy on the child who was bit. Let the biter overhear you talk to his victim. I say, no, no, no. I don't like it when biters name bite. Kids have to use their words when they're mad. I like it when kids who are really angry say, no, no, I don't like it. After a minute or two of kind ignoring, re-engage with your child with a little friendly talking or play. Later in the day, you could try talking to his teddy bear about how you don't like biting. Role play the incident and ask your child what the biter could do to make the bitten doll feel better. You might also tell a fairy tale, perhaps a little story about the girl bunny who was sad because she would bite so much that the other bunnies didn't want to play with her. So her mommy taught her a special trick. Every time she wanted to bite, she would show her teeth and click them together 3 times, but never bite. The other little bunnies thought this was funny, and then they all wanted to play with her. This made her smile, and she lived happily ever after. The end.
Learn to recognize the signs that your child is about to bite. You may be able to stop the biting before it happens if you can distract or redirect your child. Don't try to reason with young children or have long talks about biting. They are not capable of processing and understanding. Use simple and direct language. Positive reinforcement also helps. Praise your child when your child shows behaviors that you want to encourage, such as sharing, being kind, or being patient. A reward can be as simple as giving your child a hug or pat on the back and telling the child how well they are doing. Be sure to model the behavior you would like to see in your child. Avoid angry outbursts and set a good example by showing your child how to deal calmly with everyday frustrations.
So parents don't go around biting people.
Or growling at them.
And I think just remembering, depending on what age they are, they don't have the attention span for it. So take it what it is and then move forward from it. Don't hover over it.
Yeah, I definitely like the part about like don't try to reason with them. You cannot reason with a toddler. They don't understand. It's not that they don't want to. It's not they listen to you. They hear what you say, but it don't mean nothing. Like and they can't reapply it later, right? So you just quick, no biting. Biting hurts. And honestly, I found one of the best ways is to have the person that did the biting be the one to comfort the person that got bit. Go get them a wet cloth, hold it onto their wherever they got bit, and make them feel better. Teaching empathy and, the consequence is you hurt them. You've got to help them feel better.
Yeah, I get mine to like give them a hug and they pat them on their backs. We don't really say sorry yet at our age, but kind of just you hurt them. You gotta acknowledge that.
Exactly. And you got to take time out of your play to make sure that your friend feels better. You don't get to bite them and then go play while however long they need to sit to feel better, that's how long you sit with them. The biter should not get to go back and play before the person that got bit does, in my opinion.
Mm-hmm. And I think some people need to realize redirection too doesn't mean like a timeout.
No.
Right.
It means like just removing them, give them their own little corner, but they have to play and do whatever by themselves to calm themselves.
Because, as many times as we say, if you're mean to your friends won't want to play with you. They always go back to play with them. Right? So, like, we can say it all we want. It means nothing because kids forget. Like, the person that got bit is going to forget and they're going to want to go play. They're going to want to continue to have fun. Now, I mean, if they're getting bit over and over and over again, then eventually they will not want to play. But if it's like a once in a while type situation, they forget. They just want to go have fun and play again. Biting child syndrome refers to the repetitive behavior of biting done by children older than what is considered developmentally appropriate, which would be like 4 years of age and older. If said child is biting due to aggression, if the action is unprovoked and seemingly impulsive in nature, whether it happens at home, school, or daycare. Biting child syndrome is not a recognized medical diagnosis, but rather a term used by professionals to describe persistent behaviors involving biting among older children. Understanding biting child syndrome is essential, and early intervention through treatment programs that help both child and caregivers cope effectively work towards developing prevention strategies. Biting child syndrome can have negative effects on both child's development, progress, and social interactions with others. It can lead to reduced self-esteem in children who feel stigmatized due to their problematic behavior. Some children continue to bite even as they grow older, and this could be due to developmental disorders such as ADHD or autism spectrum disorder.
Experts say environmental factors play a significant role in a child's development and behavior. Children who grow up in a chaotic environment with limited boundaries or structure are more likely to exhibit aggressive behaviors like biting. Exposure to violence, abuse, or neglect can also contribute to biting behaviors in children. Emotions play a significant role in shaping how children behave. Crying, hitting, screaming, or biting are common ways for young children to express their feelings when they lack the skills needed for effective communication. Children who experience intense emotions such as anxiety or anger without proper emotional regulation may resort to biting others. Additionally, if a child has low self-esteem or feels powerless in certain situations where they cannot control what happens around them, this could lead them towards biting tendencies. Several factors contribute to the development of the biting child syndrome. Understanding these causes help parents and caregivers identify early signs of abnormal behaviors in their children before it becomes severe. Understanding the signs and symptoms of biting child syndrome is critical for effective diagnosing, treating, and preventing this behavior. Many children who exhibit biting behaviors may be going through a developmental phase or may be experiencing emotional or psychological stressors. However, when these behaviors persist and begin to cause harm to others, it is important to seek professional help.
Children who exhibit biting behaviors often display other behavioral issues as well. These include aggression towards others, difficulty controlling impulses, and a lack of empathy towards those they bite. They may also demonstrate a lack of understanding regarding boundaries or social cues, which can contribute to their biting behavior. Additionally, children who frequently bite may demonstrate frustration when they are unable to communicate effectively with others or are struggling with an underlying emotional issue such as anxiety or stress. The diagnosis of biting child syndrome is typically made through an assessment by a qualified mental health professional or pediatrician. The assessment may include a review of the child's medical history, observation of the child's behavior patterns, and interviews with parents or caregivers. In some cases, physical assessments may also be conducted to rule out underlying medical conditions that may be contributing to the biting behavior. It is important to note that biting behavior in young children is common and can be a normal part of their development. However, if the behavior becomes frequent or severe enough to cause harm or significant distress to others, it may warrant further evaluation for possible underlying causes. There are several treatment options available for children with biting behavior. Depending on the underlying cause and severity of the behavior, behavioral interventions such as positive reinforcement techniques or redirection strategies can be effective in reducing biting incidents. Parents' training programs can also help parents learn effective ways to manage their child's behavior and prevent future episodes. In some cases, therapy may be recommended for the child and/or family to address any emotional or psychological factors that may be contributing to the biting behavior. Medications are rarely used in treating biting child syndrome unless there is an underlying medical condition that requires medication management.
Okay, so children with autism may be more prone to biting than neurotypical children. However, it is not a defining characteristic of autism itself. Autistic children may resort to biting as a way to communicate their needs and feelings, express frustration, or seek sensory input or regulate emotions, even if they are capable of speaking. Due to communication deficits, they may struggle to express themselves verbally. This can ultimately lead to frustration, anxiety, and even unexplained rage attacks. For them, biting can serve as a means of communication to signal distress or discomfort. For parents and caregivers, they have to closely observe their child's behavior and attempt to identify the triggers that lead to the biting incidents. When understanding the specific situations or circumstances that prompt the biting behavior, they can work on implementing appropriate strategies to address the underlying communication challenges and reduce the likelihood of biting. Dr. Mary Barbara, a registered nurse and a board-certified behavior analyst, says, "I think biting is one of the most serious problem behaviors that I can think of. Biting will get kids thrown out of preschools and daycare. It will get them into restrictive placements. Like older kids who bite will sometimes not be able to continue on in public school. They'll have to go to autism school where professionals wear bite guards. When I think of biting, it is just something that we have to tackle as early as possible." She goes on to explain why human bites are more serious than animal bites, stating that we have more bacteria in our mouth. If you get a bite as a professional or even as a parent or a sibling, it could lead to the need to see a doctor, get blood tests, potentially go on antibiotics, and you might need stitches. I've seen biting where it's caused ligament damage and nerve damage. Jesus. That is one hell of a bite. Biting can be an indicator that there is some pain or stress that they are not able to communicate. Research has shown that animals like birds and mammals bite themselves or bite objects when they're stressed and or in pain. If we think back for anesthesia, think about the old cowboy movies where they bite on a towel or something during a surgical procedure or some painful event to try and relieve the pain. I mean, honestly, the amount of characters in like The Walking Dead when they get bit by the zombie and then someone has to cut their arm off. And so they're like, just bite down on this belt. They just bite down and they chop off their arm. My God, there's no way that can stop that pain of having your arm cut off. But yeah, apparently it can help. Let's not try it though.
Well, and like for them biting themselves, right? A lot of the babies that bite themselves are teething,
Yeah.
which causes pain. To effectively address and stop the behavior of biting in autistic children, you have to identify the triggers that may be contributing to this behavior. By understanding the underlying factors, you can implement strategies to prevent biting episodes. There are two common triggers to consider: medical or dental causes. Start by ruling out any underlying physical issues that may contribute to the behavior. Some children with autism may have hypersensitivity or oral health conditions that can lead to discomfort or pain, resulting in biting behaviors as a way to alleviate their distress. Teeth grinding and clenching, also known as bruxism.
This is the thing I was telling you about that I learned that I have.
Are a common behavior observed in individuals with autism, but it can also include other parafunctional activities like biting that can occur simultaneously. Their behavior is often linked to stress, anxiety, and difficulties with sensory processing, and can also be associated with sleep issues and other oral health concerns. Teeth grinding can lead to dental wear, tooth fractures, jaw pain, and other oral health issues. If you notice that the biting behavior is sudden or accompanied by signs of discomfort, it is advisable to consult a healthcare professional or dentist. They can assess the child's oral health and identify any potential medical or dental factors that are potentially triggering the biting behavior. Addressing these underlying issues can help alleviate the discomfort and reduce the likelihood of biting.
Okay, so this whole thing with the bruxism, I just learned this, and it can be such a huge deal for people. So like that grind their teeth. So you have to get like a night guard and stuff. So I've ground my teeth my whole life, and my teeth are like flat, like a horse's teeth.
Oh my God.
Totally. And I have ground like what are they, the like eye teeth or whatever, the really sharp pointy ones, ground it so much that into the one that's below it has an indent and it fits like where it's been ground down. And when I got x-rays of like my whole head, because I was going to get braces because I have issues with my teeth, which I have now learned is from this, the orthodontist was like, you fractured your jaw at some point.
Oh, wow.
Yeah. And I was like, what do you mean? And he's like, it could have been when you were younger. Like, did you have a head injury or anything? I'm like, I mean, not that I remember. So I asked my mom and dad, and they're like, nope, nothing that like, there's no way. And I'm like, okay, but I mean, it's there in the x-ray that I had fractured my jaw. And apparently it's from grinding my teeth so much. And like, I clench my teeth. And so I did it so much that I fractured my jaw.
That is insane. That is
Right?
crazy.
Yeah. And I was telling Cash before we started the recording that I have just learned this whole thing. And I was trying to like talk to ask my husband, because I'm like, you know that your teeth are there, right? He's like, what? I'm like, and I'm like, but do you like feel each tooth? And he's like, well, yeah, like with my tongue. I'm like, no, like I can feel each individual tooth in my mouth, and like it feels like that they're moving and like they're their
Oh,
own,
yeah.
like,
And then he's like,
right?
"Hey, Joe, what have you been smoking?"
Right? But apparently that's part of it. That's whole so and like I can't deal with the dentist. I have to have like the gas and the gummies before to like relax me, because I just can't like, and I'm like, it hurts. And the dentist is like, what do you mean? I'm like, it hurts. And they're like, tried to do this like test where they like how much they have to touch my tooth for me to feel pain. They don't actually have to make contact. If their instrument is close enough, my tooth can feel it.
Oh my
So this
God.
this is the whole thing, and it's part of autism and a sensory thing, and it's a whole fucking nightmare.
That's
Like,
crazy.
I have broke teeth from grinding them. Like, it's just, yeah, I think it's something that maybe parents need to be aware of. That like if you notice your child having like, oh, it's more than just sensitive teeth, because like I use the Sensodyne toothpaste and stuff like that. Like I understand what it is like when cold hits my tooth. I get that, but I can just feel, and it's so hard to explain, but I am just extra aware of my teeth all the time, whether I'm eating or like I don't have to be touching my teeth. It's like they just have their own, I don't know, a mind of their own.
Oh,
Or
okay.
something. Like I just, it's like I'm very aware of my teeth being there.
I'm a
And I think,
clencher, so I get it.
yeah, I definitely clench my teeth, and I play with them all the time, like with my tongue or like with my other teeth or whatever. And I can get like almost, I start like stimming with my teeth, which is so awful. But like, so I just think that it's something parents need to be aware. If you notice your kid fiddling around with their mouth more than normal, or like moving their jaw more often, stuff like that, that
Are
kind of
you
stuff.
are you autistic?
Yeah,
Like you are,
yeah. So
and you've been
I'm
diagnosed with autism?
officially no, but because I've done the testing, and I scored very, very high.
Okay.
But I haven't done the official with the psychologist type thing.
I got you.
But I've done all the other stuff.
So
So
you're
I'm
high functioning, right? You're high functioning,
yeah,
mild. Yeah.
yeah,
Okay.
yeah. So it's
Interesting.
high. and very high masking, which is a very much a Gen X thing, right? Like we're taught, don't do that, behave. And I had very strict parents. So like if you got out of line, you got a spanking, whatever. So we learn to like mirror other people's behavior. So when we're not sure how we're supposed to behave, we'll copy the other people around us and behave like them, because that's like we don't know what we're supposed to do, so we do what other people are doing. So we're just very high masking. It's very much raised in that generation, right, where kids are meant to be seen and not heard.
Yeah.
So autistic kids are very much from that generation are very high masking. I was officially diagnosed with ADHD and OCD, and they're kind of all go aligned with it.
Yeah, interesting. Very interesting.
Yeah. That's why I'm quirky.
I love that about you.
Yeah, now you know about my teeth.
Now I know all about your floating teeth that you can feel individually in your mouth.
Very weird, but I'm so glad that I have like not recognized. Anyway,
do you have any other stems other than that?
Oh yeah.
Really?
Lots of stuff like my little hedgehog.
Yeah.
That I like play with and stuff when we're doing this, because it just kind of calms me in that, right? I'm very much a picker, which is awful. Play with my hair all the time and constantly like touch there's so many.
Interesting.
Yeah.
Interesting.
And definitely a lot of sensory things, annoyingly so. Like certain things I can't touch and I'll just like it freaks me out. Certain things I can't eat because they look weird that day. Like it, yeah.
Oh, interesting.
Yeah. Yeah.
Sensory sensitivities are common among individuals with autism. Biting behavior may serve as a sensory seeking activity or a response to sensory overload. Autistic individuals may bite as a way to regulate their sensory input or to seek a specific sensory experience. Introducing sensory tools can provide alternative ways for autistic children to meet their sensory needs, potentially reducing the tendency to bite. These tools can include items such as crunchy foods, chewy items, or sensory stim toys. Offering appropriate sensory outlets can help fulfill the child's sensory needs and redirect their biting behavior towards more acceptable forms of sensory stimulation. Another way to address and stop biting behavior in autistic children is through the use of effective communication strategies by providing alternative communication methods and utilizing sensory tools. Parents and caregivers can help their children express their needs and reduce the likelihood of biting incidents. For non-speaking autistic individuals or those with communication deficits, finding alternative ways to communicate is crucial. Augmentative and alternative communication, AAC, devices such as speech generating devices or picture communication systems can enhance their ability to express needs and struggles. These devices allow individuals to select symbols or words to convey their thoughts, feelings, and desires. Sign language can also be an effective means of communication for some individuals. I use all that when I'm working with autistic kids. So I use sign language, I use the PECS, the picture communication. They work really well. Yeah, you can even use them with like typical kids. I do. When I'm like, stop, I'm like, stop, and I'm using my sign language, or you need help, and I'll use, right? Even with typical kids, it works. So
yeah. I mean, we teach like baby sign language, like, before kids start to communicate and stuff. And I find some of them will still use it as they get older and they are able to talk. They just, it's almost like they can do the action faster than they can get the word out.
Yeah.
So it definitely helps.
Yeah.
Yeah. I used to be pretty good at sign language because I had a friend, his brother was deaf. Okay. And so I learned quite a bit of it. But it's something that if you don't use it, you lose it. At least that's what I found. And when I didn't have anybody else to communicate with, like I just ended up losing it, but
I tried to go to school where they taught sign language with special needs because my brother's a special needs.
Mm-hmm.
So he's had
okay.
all those like boards and like the iPad looking thing with the pictures, and
Yeah,
the sign language is huge. In the daycare
yeah,
too, we were teaching it to the little kids.
yeah. It's a good skill to have. I mean, I think I used it more than I ever used French. Sorry, sorry, Cash.
Okay, I don't even know French anymore. I can understand it. I don't really know how to speak it anymore.
Okay, so sensory challenges can contribute to biting behavior in children with autism. Providing sensory tools and strategies can help individuals regulate their sensory experience, reducing stress and frustration, and that may lead to biting. Some sensory tools and techniques that can prove to be effective are chewable items. Offering appropriate chewable items, such as chewy necklaces and bracelets, can redirect the child's biting behavior. Cash, you mentioned that you have toys and stuff like that for your biters that
Yep,
you let
a
them.
little bin that it's meant for biting, so they can just literally just chew the crap out of it if they need to.
Yeah.
I've had also a kid come in with chewing necklaces
Yeah.
for the older
Yeah, I've
one,
seen those. Yeah.
Yeah,
and
I had
he
them
kept
for my
saying,
daughter because she kept chewing her shirt when she was younger, like around 5, 6 years old. And then her shirt would be sopping wet. So I got her those biting necklaces, and she would just wear it around her neck and chomp on that instead of her shirt.
That's a great idea.
Yeah.
Yeah, because of my sensitive teeth, I've never chewed stuff like that. Like I've never
Yeah.
bit my nails or like chewed pens or whatever. I can't.
Huh.
Every tooth would feel it. I can't. Oh my God.
Your teeth don't feel it when you're grinding?
They
Like,
do, but that must be like comforting or something. Because like I'll do it during the day as well. And if I'm having like a stressful day, I'll end up having to put my retainer, like my bite guard
yeah.
on because I'll just find myself like like I'll just suddenly notice that I'm grinding them, but my mouth will be sore. So I know I've been grinding for a while. So I have to put my
I do it in
mouth
my
guard on.
sleep. So I clench and grind in my sleep. And I know because my jaw hurts when I wake up and I have a headache and like
Yeah.
my head hurts. Like it just, yeah, mostly when I'm stressed out, right? But yeah.
Yeah, apparently I do it every night if I don't put my retainer in. So I'm really good with putting it in because my husband, I mean, he can snore like, but heaven forbid I grind my teeth. But I'm sure it's an awful sound though. Like I'm sure if someone else was grinding their teeth, I'd be like, stop it. That sounds awful. Actually, I think I've heard little kids grind them before, like babies, like when they're first getting their teeth. I'm like, wow, that's terrible.
Yeah.
But they're probably like, bitch, you're grinding your teeth.
Yeah.
I'm like, oh, my bad. Okay, so weighted blankets or vests, these tools provide deep pressure input, which can have calming effects on individuals with sensory sensitivities. The gentle pressure can help regulate their sensory system and reduce the likelihood of engaging in biting behaviors. I will say they either love those or hate those.
Mhm.
There's no in between.
Mhm.
I was recommended to get a weighted blanket. The panic that like I just no, 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 no. I cannot do it. But for the kids that like it, it is great. They absolutely love them. My husband used one because like of cold, and my foot like at night slipped under the weighted blanket, and I shot like I woke up instantly and was like just freaked right out. Get it off! Get it off! He's like, what is going on? I'm like, I think I touched your weighted blanket. Yeah, they
Does
are
he
a no
just
go for
like
me.
laugh all day, every day with you? You're
Pretty much.
hilarious.
He's moved on to like eye rolling. Now it's more annoying. He's like, oh my God, stop. Especially with some things, like certain foods. Like if I find a food I like, I beat that shit to death. Like I would eat, like I have eaten the same breakfast cereal every morning for 15 years
Wow.
because
What is
I
it?
just love it.
I must know.
It's Special K with red berries.
Oh, okay.
However, I don't like the red berries normal. Like, so I take them out as I'm pouring my cereal. I catch them all and put them in a container. And then I have another container that have the same red berries but made smaller. And then I put the smaller ones on my cereal. I can't have the big ones.
Oh, wow.
Yeah, it'll ruin the whole bowl of cereal. I can't. They have to be little, and then they have to like get soggy. Yeah, sorry. Anyway, tangent. But yeah, he won't eat lemon or raspberry anything anymore because I lemon and raspberry absolutely everything. Like raspberry jam is the only jam that I eat,
Yeah, same
and
here.
it's been that
Yeah.
way forever. Yeah. Every once in a while, I will get all wild, and I'll have like lemon curd. So he's like nothing with raspberry jam ever again. Because after 30 years, he's like, I can't take it anymore. Yeah. And like I go to a restaurant and order the same thing from every restaurant. Like every restaurant has one item that I will order.
Mhm.
Like it can be different from each restaurant, but it's like specific to that place. And if they take it off the menu, I'm like a toddler having a meltdown, but I'm trying to hold it in and be a grown up. I'm like devastated. Like I can never go to this restaurant again. This is like awful. My whole day is ruined. And normally, thank God, my husband is so great, but he'll go through the menu and find something. And he's like, you know what? Why don't you try this? And then I will order a safe meal for you. So he orders a meal that he knows I'll eat. And then I get to order the meal that's different that I'm going to try. And if I don't like mine, he'll eat that. And then I get the safe meal.
Oh, he's so sweet.
That is quite nice. I love
Aw,
that.
he's so sweet.
Right? And then he'll roll his eyes when I serve him a lemon loaf. But yeah, no, he's so good. Like over 30 years. And the worst part is we didn't really know the autism stuff until later. So it's only been the last few years that we've been learning this. And it's like all of a sudden I've been let out of a cage. Almost like I can just be myself. And I know it's okay that I do this stuff. So we're like learning it together, like, oh, this is because of this, and this is
Yeah.
because of this.
Yeah, he's so sweet. That's awesome.
Yeah, he's done really good. Yeah, he's been awesome. Okay, moving on. So, sensory breaks, allowing scheduled breaks throughout the day to engage in sensory activities such as swimming, jumping on a trampoline, or playing with sensory toys can help individuals with autism regulate their sensory input. These breaks provide an opportunity to release excess energy and reduce the stress that may contribute to biting. It's important to note that sensory tools and strategies should be tailored to the individual's specific sensory needs. Consulting with an occupational therapist or sensory integration specialist can provide valued guidance in selecting and implementing appropriate sensory tools. So basically, they're not all going to have the same sensory issues. They're not always going to need the same release or whatever. So everything has to be they're like snowflakes. We're all different. So yeah, you have to find what works for them individually. So yeah, I mean, you probably know that if you work with
I
like
do.
autistic kids in
I
school
do.
and stuff,
I work
right?
with kids. Yeah. Yeah, I do.
I mean, and they're amazing kids. They are so great.
There's like honestly the coolest kids around. They're so much fun. I love working
Yeah,
with them, right?
and they're so interesting.
They are. They are. I love working with them. They're just and trying to teach them new things and yeah, it's super cool. I really
Yeah,
yeah, autism is like it holds like I have a soft spot in my heart for it, right?
yeah,
It's yeah.
And I find they give you a different light about life.
They give you a different perspective.
Yeah.
Yeah.
online for sure they do. Yeah. And they're so sweet and innocent and yeah.
And wholesome, right?
Yeah,
Like,
they are. Yeah,
oh, they're just amazing kids. I mean, all kids are great. They're
they
just,
are.
yeah, there's something extra special about some of them.
There is.
So hopefully that helps everyone with their little biters. What have we learned today? Don't growl at your children.
No matter what the experts say, don't growl. And maybe look at them when you're talking to them.
Right? Although I definitely do not like when people look at me
No,
like that. Yeah.
I have a hard time making eye contact when I'm talking
Yes.
to people. I have a really, really hard time making eye contact because I don't like people looking at me either.
Me too.
Yeah.
Yeah, it's just I don't know what it is, like invasive maybe. I don't know if that's the right word, but it just like I feel like they're expecting more or something,
Yeah.
right? Like if nobody's saying anything and they're still looking at you, I'm like, what? What do you need? Do I need to keep and so then I ramble and then I get really obvious with like looking away and like just anywhere.
Yeah.
Yeah, no. Ugh. Don't look at me. Don't look at me. With kids, it's different though, right? When kids,
Oh, yeah.
like I can look at kids in the eye, they can look at me, all good. And even like the touching thing, hate to be touched. I just like, don't touch me. Like, I don't want to be like a cold-hearted bitch, right?
Yeah.
I'm like, obviously I can have hugs from my husband, but I'm just, if other people, I'm like, no. But for kids to hug me, not an issue.
Yeah.
Does not bother me whatsoever.
Yeah.
But everybody else don't hug.
Yeah. Yeah. It's awkward, right?
Yeah,
But when kids do it, it's totally fine. Yeah. Maybe that's why we work with kids. We just
probably.
don't like adults. Don't look at me. Don't touch me. Don't talk to me. Don't make eye contact with me.
Definitely don't
Unless you're
stare
a
at me if I
child.
hit you.
Yeah.
Oh my goodness. Okay, so that's it for Day Home Divas this week.
Don't forget to follow us on Instagram at Day Home Divas, on TikTok at dayhome.divas, and join our Facebook group Day Home Divas.
If anyone has any topics you want us to cover, or if you have any questions or suggestions, you can email us at dayhomedivas@gmail.com.
We would also appreciate it if you could rate and review us on whatever platform you're listening on. It really helps the podcast move up on their charts so it gets more exposure. Hope you join us again next week. Goodbye.
Bye.
Bye.